welcome back to the Giving Back to Gwinnett podcast. Each episode we tackle community issues, tell stories that matter, and show how you can make a difference. Presented by the Gwinnett Coalition and the Community Foundation for Northeast Georgia, Giving Back to Gwinnett showcases the nonprofits and people making an impact in Gwinnett. I'm Heather Loveridge, founder of Magnolia Media Group and chief storyteller for the Community Foundation, and I'm your host. Today we are tackling a very important topic, especially in light of what we've all experienced during the past year: mental and behavioral health. I'm joined today by Chad Jones, who is Vice President for Business Development for Viewpoint Health here in Gwinnett, and Farley Barge, co-founder and Executive Director of Navigate Recovery, also here in Gwinnett. Well, welcome everyone, and thanks for being with us today. And
thanks so much.
Thank you, Heather.
Yeah, you're welcome. So, Chad, tell our listeners a little bit about Viewpoint Health and what you want them to know about who you guys are.
Okay. Yeah, and thanks so much for having us. This is a great honor. So Viewpoint Health, we are listed as one of the 23 community service boards in Georgia, which is just a fancy way of saying we're the safety net. And what a safety net provider is really focusing on individuals that are uninsured or underinsured and really have high risk, most in need kind of challenges. We offer a full range of services from outpatient services all the way to, we do a lot of community-based work. We are embedded in the schools and jails and all those kinds of things. But really, I think what I'd like for people to know the most about Viewpoint Health is being a safety net where we provide a full continuum of care. So we are a full comprehensive provider. So if you have everything from crisis and need crisis stabilization, if something like that happens, then reach out to us. If you don't have that kind of need with crisis, and it goes all the way down that continuum, say, hey, I just need someone to talk to my kids. We provide that service as well. So kind of the, as the industry term here, the one-stop shop, we're kind of the one-stop shop for that. And we just want people to know that we are definitely the safety net provider, and we're here to offer all those full continuum of care services.
Yeah, awesome. I remember when I visited you guys with Randy, and I was just impressed with just how much was offered and how big you guys are and how many, how much you cover.
Yeah, so, that's right.
Yeah, that's awesome. All right, Farley, tell us a little bit about Navigate Recovery and what you want people to know about the important work you guys are doing.
Well, thank you, Heather. So at Navigate Recovery Gwinnett, what we do is we provide services to connect individuals and families that have been affected by the addiction crisis. And for those of us that have been around for a little while, you might remember that was the crisis that we had before the COVID crisis. And unfortunately, it's not gone away. In fact, it's gotten worse during the time frame. But our real focus is to provide peer supports for those individuals. That's people that have the same or similar lived experience that are a little further down the road that can sort of lend a helping hand to someone to carry them along the way. And we do that in 5 local emergency rooms here in Gwinnett County, at Eastside Hospital, at Northside Hospital, and at Emory Johns Creek. We do that every day, 7 days a week, 12 hours a day for those folks, as well as provide walk-in services and recovery coaching for individuals or family members that are affected, which is really important, by the way. And we do that as well 6 days a week in our facilities in Lawrenceville.
Awesome. Well, I love that surround sound because, like you said, if the families don't understand what's happening or how to support or what they need to do,
yes,
that's a big missing piece.
Very important.
And if I remember correctly, too, everyone who works for Navigate Recovery Gwinnett is also in recovery, correct?
Yes, they are, and that's the peer-based part of it. So these are people with lived experiences that have been there. Many times they've sat in that same bed in that hospital as the individual they're talking to. So it's a pretty powerful connection that's made with them because suddenly someone feels safe and can talk openly about their addiction and their problems, and hopefully can connect and continue to receive help, which we do one other thing, which is we also track with everyone for up to a full year. So we don't drop them off after 90 days like most of the services do. We stay with them for a year because oftentimes people will come back in 6 or 7 or 9 months, maybe a year later, and say, You're right. I think I do have a problem. Can you help me?
Awesome.
And we've partnered, Heather, with Farley and Navigate, and have had some great success with their peers. And as Farley said, I think individuals are going to talk to someone who's been there, done that, more than they are to Chad and Farley.
Right.
Because they're going to say, okay, well, you've walked my path, and now I want to be on that path, and they kind of hold their hand through that recovery path, and just give them a huge shout out, because we've thoroughly enjoyed that partnership with them.
Yeah, and I have to say that Viewpoint Health and Jennifer Hibbard and their whole team were some of the first partners we had back in 2014 when we launched. So. That's right. So it's been a good partnership.
I love that. The community collaboration, which we'll talk a little bit about later too. And we'll also talk about, we've mentioned the pandemic and what's come out of that, but let's go back a little bit and talk about, and Farley, you alluded to some of the big issues you've seen in our community over the past 5 or so years. And I'm going to toss it to you, Chad, first, just to talk about that.
Yeah. So, like everything, we live in a world right now that we say pre-COVID.
Right.
Pre-pandemic and pandemic, right?
And then post.
So,
right.
So you say the last 5 years, you gotta, the last year doesn't even count right now.
Right.
I mean, that's just, I'm sure we'll talk about that in a little bit. But, but for the last 5 years, I think some of the biggest things that we've experienced is we have had a tremendous amount of growth rate, what I told you about, really focusing on individuals that are high risk or most in need.
Yep.
That growth rate really was driven in part by the state behavioral health authority, really is under and still under a settlement agreement with the Department of Justice. And their goal, their agreement together, which we all agree with, it wasn't adversarial at all, but the agreement was to come together, and people that were long-term hospitalization or long-term incarceration, let's get them to the most least restrictive environment. People are going to do better and thrive better if they're in their community, not in a hospital setting. And you're talking about some folks for years. So little by little over the last 5 years, we've seen an increase of people, okay, now let's go to the community. So we had, not that, Heather, we didn't have community services 5 years ago. Of course we did. But we've seen a massive increase of what we've had to do working inside the community with people that were long-term hospitalization or incarceration. And what can we do to keep that from happening again? So that's been probably one of the biggest influx of individuals coming in over the last 5 years.
Wow. Yeah. Well, and going along with that, Farley, and I know I think you'd mentioned earlier talking about opioid crisis.
Yep.
But what have you guys experienced?
Well, kind of to follow along with what Brad's saying, so we believe that people recover better in community. And the traditional model for addiction has typically been to send somebody off, maybe out of state or to another facility. And oftentimes when they come back, they find that nothing's really changed in their family setting or in their community setting, and oftentimes they relapse. That's when they're at most risk for overdose, death, or relapse, is when they come out of treatment. So that's why this partnership is really important, because when they handle the clinical side, they handle the detox, they handle the first 90 days of someone's recovery, where do they go from there? And really that's what Navigate Recovery is all about. We're about that safety net and stepping into that gap that exists into the current system of care, to give those individuals and their family members continuing support for the long run. You mentioned what's happened with the opioid crisis. Well, unfortunately, the opioid crisis is gotten worse. Unfortunately, that was in large part a result of some of the requirements that were in place during the COVID crisis. Shelter in place, for instance, reduced access to services, in some cases no access to services. Of course, for many of the people that we serve, which are primarily people that are in the lower income echelon, so they have transportation issues, they have a lot of other health issues, and so transportation is an issue. So all of those things sort of combined to cause a problem whereby people just were seeking alcohol, drugs, and other things to cope with their condition and their fears and anxieties over COVID as well. The result of that is that in the state of Georgia, we've had a huge increase in opioid-related deaths. Some just give some framework, some rough numbers around that. In statewide, we had 1,839 deaths in 2020. In District 3, which includes what Viewpoint Health addresses, we had 152. Here in Gwinnett County, we had 114. That's 75% of the 152 in the whole district. So that gives you a little bit of an idea where the big problems are.
Right, right. Well, and let's dive a little bit more. We've been talking, kind of dancing around the pandemic and what it's caused, but I really want listeners to grasp, because they may have read a headline, or maybe they got past the headline, read a little bit of an article, but to truly understand, yes, it's a nationwide, even a global issue, but what is it like here in our backyard? And so what's the crises, mental and behavioral health crises that have come out of the pandemic? So Barley, I want to toss it back to you for a minute just to talk about that, and then Chad, I want you to chime in too.
Well, clearly the overdose deaths that I just mentioned are probably the number one crisis on our radar right now. We are partnering along with Viewpoint Health and the Gwinnett Health Department, Audrey Arona's group, to really start to form an action plan. We're putting an action plan in place, actually, to help combat that. The first phase of that's going to be addressing the fentanyl issue. If you're not familiar with fentanyl, it's a synthesized opioid that is primarily manufactured in China, comes to the U.S. through the cartels in Mexico, and then it makes its way up into our country. Some of that comes through the ports in Savannah. In fact, we're tracking one right now that's caused a number of deaths, where they have pressed pills that are fake pills that are Xanax and I forget the other one. Maybe you remember, Brad. But anyway, and those are being distributed to people who, again, cut off from services, didn't have access to the supports. They may go out and try to source those pills from friends or someone who passed them off as legitimate, but they're not. And they're actually just laced with fentanyl, and we've had a number of deaths. So, fortunately, there is a solution for that. We believe it's sort of a multi-part solution, but the first leg of that solution is really to get the antidote, Narcan, into the public's hands. And so we're involved with that heavily. You'll be hearing more about that in the coming weeks as we put that action plan into place. In Gwinnett, I'll go back to those statistics. We had 156 deaths from 2020 through April of this year, so that includes both 2020 and this year. And 100 of those involve fentanyl.
Wow.
So that's sort of the magnitude of the problem. It is by far the number one killer out there.
And that's what you're working on with the health department, with Dr. Arona and partnership.
Yes.
Okay. All of that, rolling that out. Whew.
Yeah.
Yeah. That's
big task.
Yes. Yeah, it is. So Chad, what have you guys experienced coming out of the pandemic?
Well, yeah, as we've already said, obviously this was a year unlike any years that we've had. So, I mean, for us, World Health Organization has said it. Obviously, CDC's followed up, but that really the new pandemic is mental health right now. When we're in the second phase of the pandemic called mental health. We started experiencing early on some of the supportive employment challenges, because a lot of our clients, individuals that we serve, are going to be in sectors, or they working in sectors that got laid off. So that was the first hit. So we're like, okay, well, now let's really look at this. Then that trickled down. As soon as it hit the employment sector, then it hit the housing. So now if you don't have the employment, then how are you going to be housed? We had, Heather, just to give you a ballpark here, we've always had emergency supportive housing that we offer. That fund that we do in emergency housing, we're just trying to get people housed, and then we do something called housing first. Like, just get housed first, and then we'll talk about behavioral health. You don't have to jump through behavioral health circles to qualify for housing. So that little emergency housing fund that we have just absolutely skyrocketed to 520% this past year.
Wow.
So we're talking about 5 figures went to 6 figures in a matter of months of just getting using those dollars of getting people housed and supported. And then right in the heart of it, as the housing issue was happening, obviously there were some moratoriums and things put on those kind of evictions and things like this, which helped. But we did with just the homeless rate was just skyrocketing in the pandemic. Then we had situations where it just became too much for too many people. The suicidality rate did go up. It went up nationally, not just Gwinnett County.
Right.
Attempts went up nationally, not just Gwinnett County. So you had this effect. It was first hit the pocketbook, then it hit the homestead, and then it hit the whole well-being. And it was just and you could see it coming like a tidal wave. I mean, and there's nothing you can do but stand in front of it and just let it's going to hit. And so we have what we've done is and I'm speaking not only just for our team, but just me alone. I'll just give you my numbers. I've written more grants this past year related to the pandemic, pulled out more grants this past year than the last 7 years combined.
Wow.
So it's just going after, grant after grant after grant, everything you could pull down to be able to turn every one of those dollars into services for the community because the need was so great this past year.
Well, and we know it's real and we know there's a big issue, but we tend to think, oh, that's somebody else.
Right, that's right.
But when you can tell somebody a story, then that makes it real for them. Do you guys, and I know we have to protect privacy and all that, but do you have any stories you can share that just really illustrate kind of what's been happening?
Yeah, I think for us, is that all right? Go.
Oh, yeah.
Okay. So not to jump in front of Farley here, but just I think for us, one of the stories that resonated really well with individuals of like, oh, wow, this is Gwinnett County. This is here, was when individuals, the pandemic first started happening and individuals realized, okay, we've got something here. This is serious. And people started going to the emergency departments. The emergency departments were so overwhelmed in Gwinnett County that they were absolutely they're having to pick and choose, okay, who is at a level of care? Say, Farley has higher symptoms, so he's going to stay in the ED bed. But Heather, even though you're positive and even though you have symptoms, you're going to have to go. You're left. And it was really this I can't imagine the position that the nurses and doctors were in to say, look, we have limited number of beds and we're going to have to go with the high of the high.
Right.
And so what happened was you had individuals that were positive that needed to still isolate, because remember, quarantining was people that were around something, but isolation were people that were positive with symptoms.
Right.
So they needed to isolate, but isolate where? Because to properly isolate under the CDC and Department of Public Health guidelines, you had to have a single bathroom and a single bedroom. You had to access, and no one else could access that bathroom. Well, where are they going to go? A lot of these apartments that they were coming and going, or staying with family, or whatever it is, they had one bathroom. So we worked with Department of Public Health. This was a great partnership. Department of Public Health came to us and Home First Gwinnett. So we worked with them. I got to give a huge shout out to the Holiday Inn Infinite Energy Center. So sorry, got to plug that, because we met with them and they gave us the whole second floor.
Wow.
And we created a program we called just Project First. It was a little acronym I came up with for isolated recovery and supportive transitions, was what FRST was. And it was individuals that had to isolate and recover properly, but couldn't go back to where they came from, home, friend, wherever, family, whatever. So they went to the Holiday Inn, and the Department of Public Health pulled down some dollars to pay that. Our staff did all the visits, so obviously I was dropping off food and Chick-fil-A. Farley and Heather, you should have seen me. I look like a stormtrooper coming in there. I mean, this is early days of the pandemic, so it wasn't just wear a mask. It was like, I look like something coming out of sci-fi fiction or something. But so we were dropping off food and groceries and just checking with people. We made a whole protocol how they could enter the hotel on the backside and this kind of thing. And it was a huge success. Because it gave people a chance to recover, even children, parents and children were there together to recover in a safe, stable environment, and then from that point, then you could go obviously to your next destination. But the ERs, they were grateful because we don't know what to do. We don't have space.
Right.
So it was one of those situations that was right here in Gwinnett County backyard that some people probably don't even know what went on. But it was a big success.
Yeah, it's those supposedly untold. They're not
Right.
untold to those who know, but to the rest of us.
Right.
And that the partnerships, like, that's, to me, that's been one of the silver linings that has come out of this. Just seeing
Right.
people go, okay, how can we get creative and figure out how to solve this? Farley, what about you guys?
Well, so the effect of the coronavirus on the services that we provide was a little different. Because we are a vendor with most of the hospitals that we partner with, every one of the hospitals did the same thing all at once. They shut off all vendor access. So that meant that we had to operate virtually and try to still stay connected. So if they had someone show up, they would call us. But the reality of that situation was just as Brad outlined. They had a priority list. I mean, they had to treat the worst of the worst first, and they were overwhelmed. So in most cases, what happened if someone came in with an addiction, they were underinsured or not insured at all, they were probably referred to Viewpoint. Unfortunately, Viewpoint, because of COVID, had to change their protocols and their setup, so they had reduced beds available for those people, and the net of it was that in a lot of cases they were treated and they had to go home, and then we would try to pick that ball up from there and stay in contact with them, which we did with many. In fact, our call volume went up tremendously during COVID last year. We had more calls last year than we've ever placed before. Wow. But that was in lieu of meeting with them in person. So we were just constantly trying to reach out to people and have conversations and see how they're doing, and just in the hopes to keep them moving along. Now, as things began to ease up a little bit, as we got towards late summer time frame, we started to see some of the more severe cases coming into the office. Well, I need help now, or family members coming in. I need help now. Can you help me? And since that time, the floodgates have basically opened, and we're seeing more people now than we've seen in quite a while. In fact, recent numbers just from we know from the hospital side alone that they're seeing averaging about 2 overdoses a day there. Now that's an average. Some days they don't have any, but typically that happens on the weekends or close to the weekends. So they get a lot on the weekends, and we'll get 6 or 7 calls in some days, So that's kind of how it affected us, and there's many personal stories that go along with that, but they all have a similar storyline, if you will, and that's that they had access, they were doing better, they got worse, and some of them died, and those that survived are trying to make it.
Mm-hmm. Wow. Well, let's transition. Kind of, we talked about the past, and let's talk about kind of what's happening right now, because like we've acknowledged, we're on the tail end, and just dealing with the effects of the second pandemic, kind of like we said, the second crisis. Right. So, Chad, maybe this is where you want to talk about resilient Gwinnett, but kind of what's going on right now with Viewpoint Health and kind of tackling what's happening.
Yeah. So what we're doing is obviously trying to be more proactive. I think that sometimes when these pandemics, and not just this, but just state of emergencies happen, or something hits the news, people refer, the mental health crisis. Mental health itself is not a crisis. What the crisis part of mental health is the access to care. It's staying in care, all right? So if you could have a brick and mortar shop, and we have 5 of them. We have actually a lot more, but we have 5 clinics, but a lot more than just those clinics. And you can say, hey, people, Heather, you can grab somebody. Hey, here's this guy's card. Go down and see this guy, all right? But there's a transaction that happens between you referring somebody and them actually walking through the door. So what we've done over the last few years, and what we've applied for recently with some federal grants, is to really enhance that access to care and take it to people where they're at. So we've done it a couple of years ago. We started in the school system. We had 4 schools where we had a clinician embedded at the school. So you're keeping a mom or dad from taking their kid out of the school to take them to an appointment. Well, the appointment's at school, so you don't have to check anybody out. We've gone from 4 schools down to 31. We have 31 schools. So it's taking that kind of concept and really beefing up what we're doing in the community to say, hey, we're going to meet people where they're at, and we're going to get creative with a plan of care around what people want. So meet them where they're at, give them what they want. And by doing that, like I said, we're applying for several federal grants. One is Certified Community Behavioral Health Clinic is what the acronym is, CCBHC. By doing that, you're talking about community level care on steroids. I mean, it's just, if this comes through with the other grants we put together, some working with Farley on some medication assisted treatment type stuff, you bring all that together, then you've got, like I said, community work on steroids. I mean, it's going to be just completely overpowering, really enhance what we're already doing. But that's what we're trying to do to address it, is try to really focus around how do we see mental health. That mental health itself is not the crisis. The access to care and staying in care is the crisis. So how can we bring the access to people at more spots, more places? We do a lot of this, Heather, with law enforcement. So not only, I mentioned we have clinicians embedded in the school, we now have clinicians embedded in law enforcement. They actually do ride-alongs with law enforcement. We call it a co-responder model, so that the deputy can say, Deputy Farley over here can grab Chad and say, hey, Chad, I think we got a mental health situation. Come over here and talk to this guy. We've worked with them over the years and really have reduced the level of incarcerations, significant. When I say reduce it, significantly reduce the level of incarceration where Officer Farley has to take somebody in. So it's working of meeting people where they're at, giving them what they want. Really, it's our focus.
So would you say also, because thinking through this, there's also the aspect, I think, of people are more aware, and so maybe we're lessening the stigma around mental health and getting help, and even behavioral health. What would you guys say to that?
Well, definitely. So reducing stigma is a huge area of concern on our part. Because stigma does still exist. Unfortunately, I just read an article just this morning about the data showing that women, for instance, are now have surpassed men in their use of alcohol. Wow. And it affects women so much more dramatically than it does men for mental health reasons and for other reasons. And they have a lot more negative outcomes when they drink alcohol. And so that's a statistic that people aren't familiar with. They don't recognize that. And so when we realize that, and we treat it like a chronic condition, when we realize that addiction is a chronic condition, I should say, and it's not a moral failing. It's not you made a bad choice, you need to stop doing that. It's not it's not that you're weak-minded or weak-willed, right? Mm-hmm. We've learned so much more about the science of addiction in the last 20 years than we've ever known before. And to a large part, it really has validated a lot of the earlier models that were developed in the fellowships and such, in that we realize now that it takes about 2 years for someone to have an abstinence-based recovery before your brain reaches homeostasis. That means before it starts functioning normally again. All these things are scientifically proven now. So it's really educating the public about that. So one of the things that we're doing to address this opioid crisis that we've been talking about is engaging with the health department along with Viewpoint Health. We're also partnering with Home First and several other partners. Guide is also involved in this coalition. We formed a coalition to get Narcan out there, but also to educate. So we want to educate people about the science of addiction, what's really going on, because when people understand what's happening, they begin to look at it a little differently, and they begin to realize that it's not that my loved one is crazy and hates me now. It's because they're being affected. Their brain chemistry has been changed by the addiction, and that as a family member, there's some things that you can do to help respond to that appropriately, and to support them in that. So education is one of the strong areas. Talk about the language that we use. Okay, so a lot of times we don't use the best language when we talk about people that have been affected by addiction. We call them addicts, we call them druggies, and we call them a lot of different things that are kind of demeaning. Let's face it, the media today doesn't still portrays most people with addiction as a person that is destitute and living under a bridge somewhere. Now that can be the case, but that's usually the worst case. In fact, the vast majority of people that are affected by addiction, over 70%, they have a job. They get up, they go to work every day. They're probably married and have a family. So it affects a whole lot more people than we realize. So being able to address those things, and then of course to distribute the Narcan, get that out into the community's hands is the final leg of that. And that's really to make sure that people understand that Narcan is an antidote, that it can reverse an opioid overdose. In the case of fentanyl, you might need it 3 times in order to make it work, because that's how powerful that particular drug is. But really giving people access to the education and the drug they need to reverse it. And my personal belief is that everyone should have access to Narcan. You should have it in your car. Its shelf life is tremendous, and it's very tolerant of extreme temperature changes and so forth. So you can put it in the glove box, you can put it in the refrigerator at home. And by the way, you don't have to fear using it, because if you use it and it wasn't necessary, it doesn't have any adverse effects.
Yeah.
I wanted to piggyback on something, Heather,
Sure.
if that's okay, that Farley brought up a very, very good point as it related to stigma. And Farley said on what people are called, some of the labels that you were talking about, Farley, that you put on people. We just had this conversation recently, how it relates to language and stigma, because Heather, you're right that there has been an increase in mental health awareness, and the pandemic probably pushed some of that too. But being aware of something doesn't overcome a stigma just because you now are aware of it. We believe a lot of it starts with the language. And I'll give you a really quick personal example. This was Memorial Day. Not going to say any names because of obviously protecting people's privacy. But one of my family members, we were talking, and were headed back home from Memorial Day, and we said, hey, keep us in your thoughts and prayers. I've got a little polyp thing that they need to test because he has lung cancer, and it's now in the adrenal gland. And we said, okay, sure. And so it was very open conversation, physical health. Okay, keep me in your thoughts and prayers that I may have my cancer coming back. Oh, for sure, we'll definitely do that. As that conversation was finishing, I received a crisis call from a family member and said, hey, could you guys come talk to my uncle? Because, my uncle's schizophrenic. So we would never look at my family member and say, hey, you're cancer. You follow me?
Right.
It's language. He is my family that is battling and on the road to recover from and try to beat cancer. But the other family members say, well, come talk to my uncle, he's schizophrenic. And sometimes in behavioral health, we take that diagnosis or that challenge and we define people by it. And we take that and we make that the label of somebody saying, this is who they are. Heather's bipolar. Heather's bipolar. Heather's schizophrenic. Well, no, Heather is Heather, who's a great lady who is on the road to recovery for schizophrenia.
Right.
So a lot of that stigma starts with language. And until we get to that point, then guess what? People will always talk about physical health. They will always talk about, well, pray for me, I'm dealing with this, or, last night I had my bronchitis, or whatever it may be. People always will talk about it, but until we change that language, people are going to keep mental health very quiet because nobody wants to be labeled by it.
Right. And that gets in your brain. I mean, then you associate that with...
And I was raised in the South. I'm actually an original Atlanta native, and I'm old enough to remember that, in my family and many families, you never talked about mental health. Right. That was kept quiet. You didn't want people to know about it. In fact, there was a time when people looked at cancer that way, right? They got cancer. Don't talk about that.
Well, and we are out of time, so as we wrap up, because we always want to end these episodes with a way for our viewers to get involved. And I'll toss it to you, Chad, first, and then to Farley. What's the best way for people to either support Viewpoint Health or get involved, or just, what would you say? What's the action you want our listeners to take?
Yeah, I'm so glad that you posed that question. I do want to just mention one quick thing about some of the partnerships. One of the partnerships that's new for us, we have a lot of partnerships, is working with Resilient Gwinnett, which is part of Resilient Georgia, and getting involved in that through that organization. They're a great initiative. They're doing a lot of work around training for specifically children and youth that have adverse childhood experiences, ACE, we call them ACEs. And so we're working very closely with them of getting trained up and giving a list of the trainings that we do and really trying to get the practitioner providers trained in that. So it's getting involved in really kind of Googling Resilient Gwinnett and looking at the Gwinnett Coalition. And so how can I get involved and how can I support this, either from a volunteer basis, we also have, if you say, I don't have the time to do those kind of things, we also have for Viewpoint Health, we have a 501c3 that is called Behavioral Health of Georgia. So how it works with that, with our 501c3, is 100% of anybody that puts out donations or anything, 100% goes to all this care, all these partnerships we talked about, all the care that we've talked about. So it's behavioralhealthga.org. And we don't even ask people to say, hey, look, just do your normal routine. Just think about it. Just remember us. This is the way for you to get involved in mental health, and this is what I mean. If a lot of us shop Amazon. My wife lives on Amazon. She's probably on Amazon, Heather, right now as we're doing this. But we tell people, hey, if you go to Amazon, Amazon's got a great program called Amazon Smile. Mm-hmm. So if you go to Amazon, when you go check out, just look for Behavioral Health Georgia. That's it. You're going to do Amazon anyway. So just do your thing and then go there, look for Behavioral Health Georgia, and then those Amazon Smile proceeds from Amazon will come to us, and we can. So there's ways to give back like that. Obviously, give back in time, and then educate yourself. Just so we talk about Resilient Gwinnett, just educate yourself on what's going on out there, what's going on with Department of Health, what's going on with Navigate Recovery, and be able to talk through it with people.
Mm-hmm. Farley, over to you. What do you want our listeners? What actions can they take to help support you guys?
Well, clearly they can volunteer with our organization. They're welcome to attend meetings. They're free. Everything that we offer to the public is provided free of charge, thanks to some grants that we have from the Department of Behavioral Health and others, such as Gwinnett County. And so we don't charge for our services, and so that makes it available. They can simply go to our website, which is www.navigaterecoverygwinnett.org, or you can go to navigaterecovery.org and find it also. And that's one way. You'll see a giving button at the top. It allows you to sign up for volunteer work as well as donations, which you can make. I would like to mention that we have a special program thanks to Kathy and Joe Abraham. We call the Honor Joe Fund, which is actually helps pay for education for people that are in recovery. So that's a great service that they provide, and people can access that through our website as well. Or you can just simply give us a call at 678-743-1808, and we'll be happy to pick up the phone and talk to you about it most any time of the day from about 7 a.m. till 9 p.m. every night. So we're there.
That's awesome. Well, Chad and Farley, thank y'all so much
for
coming and just sharing with our listeners about what's going on and the important work that you guys are doing and the partnerships that are happening because of this. So thank you so much to everyone for joining us today for the Giving Back to Gwinnett podcast. If you'd like to learn more about the Gwinnett Coalition or the Community Foundation, please visit them at gwinnettcoalition.org or cfneg.org. I'm your host, Heather Loveridge. Thanks again for joining us, and now go make a difference in your community.